All right, guys, this is Troy with Advanced Spine Joint Wellness. Welcome back to our podcast and our weekly little Facebook live session. So today I have with me Dr. Cory. Last week we talked about sciatica and gave a lot of information about sciatica, and we have Emily. I don't know if you can see Emily over here on the side. So today what we're going to do is talk a little bit about inflammation, some of its sources. And this is a great talk, and it's real easy to let this one spin off ours. So we're just going to we have an agenda, but we'll see where we get to with this. But it's great information to kind of give you ideas of where can inflammation come from. There's three sources. Before we get started, if you want information on this, you can go to ohiopain.com. If you're interested in a consultation, you can also contact us directly, 330-242-7669. And podcast soon should be up on iTunes under Body Talk. So let's get started. Dr. Cory, inflammation and sciatica. We talked about sciatica last week, and let's talk about some of the sources of inflammation, and we're going to start with number one, which is physical sources. We're going to call this one the obvious. We're going to talk about the obvious and not so obvious today. So physical sources are kind of the obvious ones, and maybe talk about some of the physical sources of inflammation. Where do they come from? How do they contribute to problems?
Okay, well, just plain simple injury. So anytime you're injured, your body's most natural response, and the first response to injury is inflammation. It's going to send a lot of blood flow to the area. I'm talking about sciatica in general. So any type of low back pain, disc bulges, or just muscle spasm, the body's going to cause inflammation in that area by that increased blood flow. When that does occur, we're going to get swelling. So whether it be soft tissues, muscle themselves, they're going to swell up with that increased blood flow, which will then cause pinching on nerves. And other chemical reactions in the body. A very simple one is the body, anytime there's damaged cells, it releases a substance called substance P. It's a big modulator in pain and more on a chemical level, but just the basis of inflammation pinching on nerves, those tissues, you're going to get a pain response right to the brain. So anytime there's any type of injury, whether it be low back, you sprain your ankle, you break a bone, anything like that, so always the body's first way to get not only the important healing properties of the body, so all the cellular stuff, but also just to stabilize. That inflammation is good, but it also then does present an issue with causing that pinching on nerves and other tissues. So, it's very common, and it's stuff we overlook, and pain is, always a symptom. So it's your body telling you there's an issue. So that's something to listen for big time, because, if our body could send us a text message saying something's wrong, I'm sure it would. It'd be a lot easier, but all we have to do is rely on the pain receptors. So
yeah, if you only had a check engine light, huh?
Right, I know.
Yeah. So physical sources are pretty common. They're real easy to identify, and I would say our healthcare system in general is actually pretty good at identifying these. So if someone has arthritis in a joint, or maybe a pinched nerve, or a tendinitis, something like that, we're pretty good at addressing these. So sure. These are pretty obvious. They're easy for us to pick up, diagnose, and treat. The not so obvious.
Where it gets nitty and gritty.
So the not so obvious, environmental influence, I guess we'll kind of label this one. So the not so obvious, and a lot of folks, this might be new to you out there. So if you haven't heard this before, this may be new to you. And maybe if you have rheumatoid arthritis, autoimmune disorders, thyroid disorders, anything else you can think of that's inflammatory, lupus, fibromyalgia.
That's a big one.
There's a big one. And a lot of people with fibromyalgia out there are just kind of smoldering along and maybe trying to treat this with just the physical treatments for it. So they're identifying physical sources of pain, but completely ignoring the environmental influence. Yeah. So let's talk about that, because this is a huge talking point. We can probably go for hours on this one. We only have about 15 minutes,
Yep.
But let's talk about it. So rattle off some environmental influences.
So
how does this contribute?
For sure. The biggest thing, myself, I always encourage patients to drink water. A lot of hydration. Water's the easiest thing to get. It's the healthiest thing for you. But when looking at it, we got to see where our water's coming from. I know a lot of us, some people don't have access to, nice filtered water. So just making sure you know what's around you. So we have stuff like, chlorine in the water. It's stating, and chloride. They're added there to help protect. Chlorides for the teeth. You always get fluoride and chloride treatments at work or at the dentist. Well, that being put in the water, it's being introduced in our body, which is definitely not good. These added chemicals, runoffs from other streams and farms. We use chemical, pesticides and stuff. That's not natural stuff that occurs in our body. So when that does enter our bloodstream and through our system, our body's going to respond to that. And any foreign substance is going to, cause an inflammatory reaction. So sending the cells to go and attack and remove it are going to cause those, responses to, flare up the body, because it's, like I said, it's not known to the body. They have no idea what's coming in there. It's not something normal. So as that happens, our body reacts in a certain way. It can cause, like Troy was saying, to develop autoimmune disorders. We mentioned fibromyalgia. It's such a blanket term that I feel like is used all the time. And maybe something as simple as a diet, or seeing what's in your water, what you're putting in your body. Exposure to things in the air that we're breathing. You live in big cities, you have cars that are spewing out chemicals there, factories, or just applying yard chemicals or things in cleaning materials in your house. Those things are going to leach into your water, as well as if you're not protecting your body wearing gloves or a face mask, you can definitely inhale them where they get absorbed through the skin. So making sure we're knowing what is in the products that we're using to do everyday things, as well as put in our body to eat. So it's definitely good to be self-aware of what you're doing, always looking at the back of stuff, trying to stay as clean as possible. There's a lot of things out there you can make on your own, such as clean materials that don't have all these added chemicals that are bad for you. So there's always alternatives, but just knowledge is power, and educating yourself, or asking your practitioner and us, or your other doctors that you go to. Just that education point is huge, and to know what you're doing. So
sure. Going back to the water one, we put 2 recent articles. These were both published in studies through the FDA, and FDA had noted that in some of the water supplies, and it was quite a few, that there were trace portions of arsenic in some of the water, which we know is terribly toxic towards our body. And you had mentioned fluorides, chlorine, and things like this. So basically, if you have an autoimmune disorder or inflammation that just doesn't seem to be responding to traditional physical treatments, meaning pain medicines, cortisone injections, chiropractic adjustments, physical therapy, this second one is a big one to look into. So water is good. We want people in pain to drink a lot of water. That actually helps. But we want to make sure that you're getting it from the right source.
Yep.
So if someone's going to get it from the right source, I think some of the best that they've studied, distilled water, is fantastic. And just giving you ideas out there on ways you can kind of clean this one up. So distilled water, number 1. A reverse osmosis system in the house. They're actually pretty inexpensive. They're only like $500 to put things in, something like that. And then Brita filters, like you see these little Brita things, real easy things to do. And actually those little charcoal filters in a refrigerator have been shown to actually do a pretty good job at filtering out some of the toxic things that are in our water. So water is a big one. You had mentioned foods, and I think in the not so obvious, foods is number 2.
This is my favorite one actually to talk about.
And this one is the one that we can go on forever, and we're really gonna talk about this one. And foods. Let's talk about gluten and dairy. These are the first 2 easy ones to pick on, is gluten and dairy, because they're both terribly pro-inflammatory. So what do we usually recommend with gluten and dairy? What would be the recommendation to someone out there with an autoimmune disorder? What would you tell someone with an autoimmune disorder out there?
The simple and easiest way to address that is eliminate them from your diet. Just completely get rid of them. They're 2 of the most reactive things you can put in your body. So if you are feeling some fatigue or symptoms that your body's not feeling the way it is, and you're feeling a little bit off, I firmly recommend an elimination diet. And in those diet guidelines, you can look anywhere. Normally, the number 1, number 2 things you get rid of are gluten and dairy, just because they are super reactive in the body. Dairy, first and foremost, is we are human beings, we are mammalians. So, as a baby, if you look at cows, dogs, cats out there, they're drinking milk from, as they're infants. As they get older, you don't see them going and getting milk. You see them drinking water. So as humans, as we're babies, drinking milk's important. But as we get older, we need to transition away from that. We've fallen into this societal, thought that milk is good for calcium and strong bones. Well, actually, it does the opposite. There's studies out there you can go and look and find them that the calcium that you think you're getting is actually being leached away or taken from your bones as you drink more, dairy and milk and stuff. There's other things you can add to your diet, such as broccoli and stuff that's actually got more calcium. It's also leafy green, so it's also really good for you. But on the gluten side of things, it's extremely inflammatory for your body. As we eat it through breads and stuff, even if you don't have a disorder that causes that, and you're just sensitive to it, just consuming too much will definitely cause some reactions in the gut. There's a thing we talk about, leaky gut, where the junctions in the cells actually separate, and then you can cause other particulates to leach into your body and cause more inflammation. But like Troy said, the best way to stop it is get rid of it.
Yeah, I think it's a couple of things that we always recommend when we see someone with an autoimmune disorder. When it comes to looking at all 3 sources of inflammation, when we talk about the environmental influence, the easiest 2 things to do: increase clean water and get rid of gluten and dairy.
Yep.
And a lot of patients always ask, you hear about celiac sprue, which is like the true gluten sensitivity. So, there's positive tests, things like this. You can do some scopes and kind of confirm that. But even in the absence of celiac sprue, we still recommend that patients stay away from gluten. We know it's pro-inflammatory. It's not great for our bodies, and it's one of the easiest to start working on. Let's move on to another one, because we can talk about those two for hours, and we only have 15 minutes to get a good chunk of information out. Artificial sweeteners. So,
take this one off. It seems like you seem to really like that one a lot.
So, artificial sweeteners are a big one. So, when we look at artificial sweeteners, we know that these are terribly pro-inflammatory to the gut.
Okay.
In gut health, you mentioned this term leaky gut. Gut health is critical. And to kind of give you a little sneak peek, on Myth Monday next week, Dr. Lily, who hates being on camera, is going to be talking a little bit about gut health in her new nutrition program here. So stay tuned. I'm not going to be a spoiler and talk about it, but these artificial sweeteners are extremely pro-inflammatory to the small intestine. So they're pro-inflammatory to the small intestine, but they're oftentimes recommended to diabetics. And aspartame, neotame, Splenda, these artificial sweeteners are actually insulin stimulants. So in a lot of diabetics, they're actually propagating the issue. So a lot of diabetics don't realize that, and they're causing poor gut health. So the artificial sweeteners are first on my list to really tease apart when I'm talking about nutrition with someone and someone with an autoimmune disorder, for what are they sweetening their foods with and what kind of things are they drinking. For instance, we had one of our age management patients. He was drinking 12 Diet Cokes a day. So that's a lot of aspartame. And if you look at aspartame, it actually, there are some studies that show there's a correlation with leukemias and aspartame. So looking at aspartame, even Pepsi has noticed that they need to get this out of their Diet Coke, or their Diet Pepsi. Sorry, I mixed the two, Diet Coke, but it doesn't matter. They all know that aspartame is a bad player, so you're starting to see that less and less in some of these soda pops and other things. So aspartame, we know, is a big player. Now, the companies that make these artificial sweeteners have realized that, so they've made a new one. It's called neotame. It's a sister to aspartame. They promote it as being safer, but it's not. So if you're seeing neotame in some of your things and it used to be aspartame, it's the newest and latest, the greatest to try to trick us. So we have to be real conscious of these artificial sweeteners. So staying away from those things in general is by far another thing that you should start doing, as well as artificial colors. Artificial colors are another bad one. So if you look at artificial colors, red number 40, yellow number 6, blue number something. These things, when you look at them, are extremely pro-inflammatory. Where they come from, where they derive from, is actually, if you really trace them back, is coal tar. So that's what they're made from, is coal tar. And that's the same thing that's in cigarettes. And you might see some ads on television now that say that certain companies, food companies, are marketing bad things to your kids. This is what they're talking about. See, when you see these billboards that they're really getting frustrated with the marketing that's going towards kids, these artificial colors are bad players, and we know it. And they're causing inflammation in kids and in adults. And just to kind of give you an idea on the importance of this information and the inflammation and its environmental influence, there's a young researcher up there, I think it's Brigham Young. Her name's Dr. Yu. She's a PhD, and she researches cancers in kids and women. And what she found was that there was one thing that parents could do to eliminate the cancer risk in their kids. And what they could do was start getting rid of pro-inflammatory foods. So she did a great study on this, and you can look it up over at Brigham Young. It's a great study on this. But the inflammation that we talk about isn't something that is easy to identify in terms of its source. So the artificial sweeteners, artificial colors, these are big ones. Now, if you think about artificial colors, what we used to color our foods with in the past were things that were natural and were actually anti-inflammatories. And I'm just going to pick on one that's actually really good, saffron. So if you think about saffron, you know much about saffron?
A little bit, not a whole lot.
So saffron's actually, it's yellow in its color,
okay.
And it's actually an anti-inflammatory. So that's what used to be put in our foods to actually color our food, like macaroni and cheese.
Okay.
So that's what used to be in mac and cheese. They color it and give it some flavor, but it's expensive. So food companies then replaced that with yellow number 40. So the reason that Dr. Yu's research was so important, and this really hit me hard when I heard this stat, was if you go back 50 years and you said, okay, what's the number one killer in kids? Number one killer in kids, accidents, slips and falls. Fast forward 50 years to today, what's the number one killer in kids? Slips, falls, injuries, accidents, still is. But go back 50 years, the number two killer in kids was, who knows, I don't know. But now the number two killer of kids, cancer. So the number two killer of kids is cancer. And that was something that was way, way, way down the list 50 years ago. But now it's number two. And this researchers saying the number one source is inflammation. To say that this has a minimal impact at this point is not a subtle thing to talk about. So it's important. So all the artificial sweeteners, artificial colors, gluten, dairy, if we can start eliminating these things out of our foods, we know they're pro-inflammatory. I'm going to reference one more article, and you can look this one up. It's in Signs of the Times, and this is going to be done by a cardiothoracic surgeon. His name is Dr. Charles Liddell. Now, if you guys know cardiothoracic surgeons, how many cardiothoracic surgeons do you think that if you met them would like to say, I'm wrong? How many surgeons would be be willing to, like to say, I was wrong. I'm sorry. Yes, zero. Surgeons kind of tend to not like to, I don't know, they have these kind of big egos. But Dr. Liddell, he had done 2,500 bypass surgeries in his career. He was 55 years old. Writes this article in the Signs of the Times called, and it was titled, I Was Wrong. So that's the name of his article.
Claim too.
It's a huge claim. So here's a cardiothoracic surgeon kind of saying, I was wrong. And when you read through the article, what he was saying was that in 2,500 bypass surgeries, after he would do a surgery on someone, he was seeing them back with a heart attack again. And what he was doing post bypass surgery the first time was just putting them on statin medicines, putting them on aspirin, these kind of things, but he'd see them back again. And what he realized was by treating cholesterol and just numbers on a lab, he really wasn't changing their health. And what he should have done was taught them about nutrition, because it was inflammation in the first place that was present that allowed the blood vessel wall to be sticky for cholesterol to stick and then cause the heart attack, if that makes sense.
Yeah,
so
sure.
in 25 years of his career, he's frustrated that he didn't pick that up until he was 55, so he's totally changed his practice. And again, it was March 2014, Signs of the Times, Dr. Charles Liddell, if you want to research that article called I Was Wrong. Fantastic.
Great.
So we're only down to about 2 more minutes. I know I rambled there.
No, you're good.
Because you got me on my soapbox a little
You're
bit.
good.
Let's talk about the last one. And again, this is going to lead into Dr. Lily next week with a little bit of her Myth Monday, and that's stress. So stress also plays into inflammation. Maybe elaborate a little bit on how stress can play into inflammation a little bit.
There's definitely a few ways. The most obvious, well, maybe not obvious, but to the general eye, as we stress, it seems to compile. It's like a nasty snowball that keeps on rolling. Now our body, eventually gets caught into that snowball of stress. It goes from the mind to just having a busy mind, down to other parts. One big thing is the adrenals in our body. So cortisol is a big stress hormone. As we stress, that cortisol level kicks up. And if anything, the simple terms with hormones in our body is they all have to be in balance, because as one starts to get high or low, all of them start to teeter up and down, because it's all a cascade pathway. And I say that as one does one thing, it leads to a second. That one adjusts for the first one, and it goes all the way down. So just stuff like that. Another thing, there's some research out there that negative emotions, being negative all the time, and I'm always a person who likes to say glass half full, just positive thoughts. It's really contagious. Smiles are contagious, but negative emotions are actually linked to a interleukin 6, which is a cytokine in our body that leads to acute inflammation. Now, too much acute inflammation will cause your joint aches and pains, but you get stuck in this loop to where as more and more interleukin 6 is added to it, it starts to go to chronic inflammation and pain. Once we get to the chronic side of things, it becomes much harder to treat, and it's a longer process. And when you get stuck in this loop, it's an never-ending feeding itself. So just trying to stay positive. It's a very simple thing to do. I mean, things happen. I understand that, and we get down to take a minute to kick the dirt and say shucks, and just look up for the brighten. Things do happen for a reason, and just kind of move on to the next one. But stress is a huge thing, and it's something that we really don't think about because we're always so busy. So taking a second to just decompress, relax for a second, and then always talk to somebody too. The emotional health side of things too. If you need to come and just talk, talk, because that's I like Troy was saying, someone's like a hidden behind the door there, and you really don't know about it. And you can just keep on feeding your body with inflammation. So, and kind of tailing back to what Troy was talking about, the whole food thing, nutrition. I think it's funny, we always joke around, you are what you eat, but it's, actually is, you are what you eat. So put good stuff in your body and you're gonna start feeling better. So I always kind of laugh when people say that. I'm like, well, it's actually really true. It's not really a joke.
There's a lot of truth to it.
There is.
And adrenal fatigue is a big one. We have a society where we're running more. We're trying to work earlier, work later, cram more things into a day. Our sleep is cut into, and stress and then what's called adrenal fatigue is huge. So many patients out there that have inflammation are basically killing their natural anti-inflammatories in their adrenal glands. And what happens is our glands, these adrenal glands, they're designed to work under periods of stress, but it's supposed to be that fight or flight.
Yeah.
That's what they're designed for. So if a tiger walks in the room between Emily, Cory, and I, the slowest one is not going to be in good shape. But that fight or flight response is going to kick in. We're going to get a good push of cortisol, glucocorticoids, which basically help produce increased blood sugar, epinephrine, norepinephrine. That's going to give our body the ability to move. Mm-hmm. But we do that on a consistent basis with chronic stress, and we burn those glands out. And now those are also natural anti-inflammatories, and we no longer have those being produced. So sleep and learning to slow down and be still is a big one. So, and we are way out of time already. So next week, 2 things to pay attention to on Monday, Myth Monday, with Dr. Lily. She's going to have some good information for you on nutrition. Here next week, we are going to talk now about gut health. Because when you think about it, number 2 and number 3 really impact gut health with these 3 sources of inflammation. So we are going to go a layer deeper into inflammation. So if you want more information, again, you can find us at ohiopain.com. You can contact us directly, 330-242-7669. Thanks, guys. Any last thoughts?
No, just, take care of yourselves. This body's the only one you got. So, if we're talking about nutrition, get rid of that gluten, watch for the dairy. Although, with babies and stuff, with mom's breast is always best, not cow's milk and stuff. But, and then just, talk to somebody. If you're stressed, just talk. I'm good.
All right. Until next time, guys. Thanks.